A miscarriage will leave its own imprint on your body. When a miscarriage happens, and particularly outside a hospital setting, sometimes the first thing that happens is the symptoms and signs of pregnancy go. So the breast tenderness, the nausea, the exhaustion, so those physical signs will start to diminish once a pregnancy is lost. There's no doubt that your body will remember the pregnancy, but in the long term, as long as we do everything we can and you do everything you can to heal, then there's no long-term repercussions for your body. If you don't feel able for work, either physically or emotionally, then we're more than happy to give you the relevant documentation in order to make sure you have time to heal. Frequently, as I've mentioned, women will heal very well physically, but it's the emotionally bit, because for a lot of women going back to work, there are going to be colleagues who are going to want to talk about the loss and acknowledge the loss, and it's been ready for that. We would generally tell women to wait for 1 or 2 cycles before they try again. This is to allow your body a chance to heal, but also to allow us with a start point for any future pregnancy. For some women, emotionally, they may not feel ready to try again for a pregnancy for a number of months, and that's perfectly fine. You start again on your timescale, and we're there and ready to support you for whenever that is. Improving the chances of actually bringing home a baby, in many respects, comes down to making sure that you're healthy and prepared for pregnancy going into a pregnancy. And again, making sure that you've taken your pre-pregnancy vitamins, that you've stopped smoking, and that you're on medication that's safe in pregnancy. As I said, the vast percentage of women that we would see in our early pregnancy assessment unit that would miscarry experience grief. And that is even in cases where they're anticipating the diagnosis of miscarriage, because most women aren't prepared to actually be told that the pregnancy is over. So grief is a natural process of miscarriage. It's very individual, and we would have some ladies come back within 3 to 6 months with a further pregnancy, and we would have other ladies that would have greater difficulty recovering and need to link with our counselling and support services and with other outside support organisations in order to bring them into a frame of mind where they could even consider a future pregnancy. I'd love to say that those ladies we see back who have miscarried are excited about the scan, but generally they're anxious, they're nervous, and it takes them time to actually realise that the scan is good news. In many cases, it's more than just the one scan, and it also, I suppose, takes them time to realise that there is a baby going home, and that's fine. The fact you've had one miscarriage doesn't put you at increased risk of a further miscarriage. So for the next pregnancy, if you've miscarried before, your chance of miscarriage is still the same, 1 in 4. The period will usually return within 3 to 4 weeks of a miscarriage, and you may ovulate anywhere between 10 and 14 days after a miscarriage. We do ask, while your body is healing and while you're waiting for that first period, not to try for another pregnancy. And the reason being is sometimes we would have ladies that would try in the immediate aftermath of a miscarriage, have a positive pregnancy test, and it's difficult to differentiate as to whether this may be tissue that's persisting after the previous pregnancy loss or potentially a very early pregnancy going forward, and that creates its own amount of anxiety for those ladies that this happens to. There are numerous invaluable support groups within the community. The most important one of which in Ireland is the Miscarriage Association of Ireland, which was founded by 2 women who miscarried just over 30 years ago, both in Dublin, and both who felt that they left the hospital with very empty arms and with very little support. Thankfully, the Miscarriage Association of Ireland has grown from strength to strength, and there are now 16 memorial stones around Ireland and a hub other than Dublin for women who experience miscarriage loss. They have a website with regular meetings, I think within Dublin every 2 weeks, again giving you a network of people who are going to watch out for you and care for you. The Ectopic Pregnancy Association of Ireland is also an invaluable resource for our patients, and Féileacán, which deals with pregnancies that are lost beyond 12 weeks gestation. But also supposed to remember that we very much look forward to seeing you back here. We typically, when we see a person with a miscarriage, have followed these ladies through, and I'm delighted to report that 80% of these ladies we will see in a further pregnancy with a happy, ongoing pregnancy and a baby at the end of it. And it gives everybody a chance to heal when we see you in those circumstances. So to use our resources as well as what's available to you within the community, and not to sever the link just because of the grief and distress of a pregnancy loss.